Depression is a silent and insidious enemy affecting millions of people worldwide today. Many people perceive depression merely as sadness or low morale, but in reality, it is a much more complex and deep psychological condition. It not only affects your mood, but also your thoughts, behaviors, and even physical health. Therefore, understanding depression, recognizing its symptoms, and intervening in time is of vital importance. One of the most common symptoms of depression is a persistent feeling of emptiness or hopelessness. Activities that you once enjoyed no longer bring you pleasure. Hobbies, social events, gatherings with friends, or professional achievements may no longer excite you as they used to. Getting out of bed in the morning feels difficult, motivation drops, and you may feel worthless or guilty. The intensity of this feeling can seriously undermine a person's self-esteem and belief in themselves. Loss of energy and fatigue are also common symptoms of depression. Even simple daily tasks, making decisions, or fulfilling responsibilities can become exhausting. Concentration difficulties, forgetfulness, and mental cloudiness are also part of this process. Depression is not merely a psychological downturn, it is a condition that seriously affects a person's functionality. Changes in sleep patterns are another important indicator. Some people tend to sleep excessively, while others cannot sleep and stay awake for long periods at night. Appetite changes and weight fluctuations are also common. Some people stop eating, while others develop a tendency to overeat. These changes directly affect a person's biological rhythm and energy levels. Additionally, they amplify the physiological effects of depression, leading to broader health problems. Depression can also manifest physically. Chronic headaches, digestive problems, muscle pain, fatigue, and weakened immunity can all be related to depression. These symptoms often appear to the individual as merely psychological issues, but in reality, depression affects the body holistically. Chemical imbalances in the brain and the effects of stress hormones produce noticeable effects on physical health. The causes of depression are usually multifactorial: genetic predisposition, biochemical imbalances, traumatic experiences, chronic stress, social isolation, and lifestyle factors can all increase the risk of depression. Most of the time, depression is not the result of a single cause. It arises from a combination of multiple factors. For instance, a stressful work environment, irregular sleep patterns, and past traumas can trigger depression when combined. Early detection greatly facilitates the treatment process. If you frequently feel worthless, experience changes in sleep or appetite, struggle with daily tasks, or feel prolonged hopelessness, this may be a warning sign. Early awareness increases the chances of successful treatment and accelerates the recovery process. Depression is a disease, not a personal flaw or weakness. Be kind to yourself and take this condition seriously. After recognizing the symptoms of depression, the most crucial step is to start an effective treatment process. Depression treatment usually requires a comprehensive, multidimensional approach that combines psychotherapy, medication, and lifestyle changes. This integrated approach supports both psychological and physical recovery, improves overall quality of life, and reduces the likelihood of future depressive episodes. Psychotherapy is one of the cornerstones of depression treatment. Different methods such as individual therapy, cognitive behavioral therapy, CBT, group therapy, and family therapy can be applied. In therapy, the goal is to identify negative thought patterns, challenge unhelpful beliefs, and develop practical coping strategies. Regular therapy sessions not only reduce the severity of depressive symptoms, but also enhance daily functioning and decision-making abilities. Cognitive behavioral therapy, in particular, helps individuals replace distorted thought patterns with realistic and positive alternatives, fostering long-term mental resilience. Medication plays a vital role, especially in moderate to severe cases of depression. Antidepressants help restore the balance of key neurotransmitters in the brain, such as serotonin, dopamine, and norepinephrine. These medications can improve mood, stabilize sleep patterns, and regulate appetite. It is important to note that antidepressant therapy must always be guided by a qualified medical professional. Effects usually appear after a few weeks of consistent use, and the combination of medication with psychotherapy often produces the most effective outcomes. Adjusting medication types or doses may be necessary under medical supervision to ensure optimal results and minimal side effects. Lifestyle modifications are another essential aspect of treatment. Regular physical activity, a balanced diet, adequate sleep, exposure to natural sunlight, and cultivating social connections can significantly reduce the severity of depressive symptoms. Exercise, in particular, has been shown to stimulate endorphin production and improve mood. Mindfulness practices, meditation, and controlled breathing exercises also play a vital role in maintaining emotional balance and reducing stress levels. Even small, consistent steps, such as taking a short daily walk, journaling feelings, or practicing gratitude, can produce meaningful improvements over time. Social support is critical in the recovery process. Connecting with family, friends, or support groups helps individuals feel understood and less isolated. Sharing feelings openly and maintaining social interaction can provide emotional relief and prevent depressive thoughts from escalating. On the contrary, prolonged social isolation can worsen depression and impede recovery. Seeking supportive environments where one can express emotions freely is therefore an indispensable component of treatment. Stress management and routine building are also key elements in overcoming depression. Structuring daily activities, setting achievable goals, and maintaining consistent routines can create a sense of control and stability. Recognizing negative self-talk, challenging irrational beliefs, and consciously replacing them with constructive thoughts can accelerate mental recovery. Journaling, goal-setting exercises, and small reward systems for completing daily tasks are practical tools that reinforce a sense of accomplishment and self-efficacy. It is essential to understand that depression is not a personal weakness or a character flaw. It is a medical condition that requires comprehensive care. Ignoring symptoms or delaying treatment can lead to prolonged suffering and potentially severe consequences, both physically and mentally. Early intervention, professional guidance, and active participation in therapy increase the chances of recovery and help prevent recurrent depressive episodes. In addition to professional treatment, individuals can adopt self-help strategies to reinforce recovery. Developing hobbies, engaging in creative activities, volunteering, or participating in community events can restore a sense of purpose and accomplishment. Maintaining a balanced lifestyle, limiting alcohol or drug use, and avoiding excessive stressors are all part of a holistic approach to managing depression. Regular check-ins with healthcare providers and mental health professionals ensure ongoing monitoring and adjustment of treatment plans, supporting long-term stability. Recovery from depression is a gradual process, and patience is essential. Progress may seem slow at times, but every step forward, no matter how small, represents meaningful progress. Establishing a routine, seeking help, and applying coping strategies consistently contributes to a sustainable path toward mental wellness. It is important to celebrate small achievements and recognize personal growth throughout this journey. Finally, remember that you are not alone in this struggle. Depression affects millions of people worldwide, and help is available. If you recognize yourself or someone you know in this video, subscribe to the channel for more informative content and share your experiences in the comments. Your story might inspire or help someone else navigate their own journey toward recovery. Liking and sharing this video also contributes to raising awareness about depression and encouraging others to seek help, making a positive impact on the broader community.